Hello, I'm going to talk about my integrative health implementation project. So just a little bit of background on why I chose to do this intervention on my patient. I've seen a lot of long-term injury, long-term rehabilitation last year and this year, and I've seen, from observation, athletes going through an array of emotions, and I found a couple documented in the literature that my patient, that I'll talk about in a bit, experienced with her injury. So injured athletes experience fear, loneliness, shock, disbelief, anxiety, and uncertainty of the future after a serious injury. So all of these emotions that I was reading about, they happened with my particular patient. And she did look to me for advice and social support, not only in her everyday life, but also in the clinic dealing with her injury. She also looked towards her teammates, her coaches, and her parents for the same. So who was I doing this intervention on? I used a long-term injury rehab to do guided imagery with a little bit of sport performance anxiety meditation. So I used an Indiana State women's volleyball player. She was 20 years old, and she's an outside hitter. She was diagnosed with brachial plexus neuritis after a match in early October. She was initially diagnosed with an upper trap tear that was not really getting better in the first couple of days, so we took her to a shoulder specialist who diagnosed her with the brachial plexus neuritis. When the athlete came into the athletic training room after the match, she was in a substantial amount of pain. There was a substantial amount of swelling. She was in complete muscle contracture at the elbow, and she had an inability to flex her C-spine. So already the athlete was very, very nervous and very, very anxious and just wanted answers. So reflecting back on that experience, a couple days later we decided to implement the tool that I'll talk about in a minute. If you look to the right here, this is the number of kills for each player on the volleyball team at ISU. The circled number is the amount of kills that this particular patient had up to the point of injury. So as you can see, she's tied for second most leading kills. So she's a really integral part of the ISU volleyball program. Not only as a person, but as an outside hitter, as a player, she really produces for the team. So when we talk a bit about the tool, you'll see that there's a portion that says, I fear that I'll let my teammates down, which is something we really wanted to focus on when implementing this. So what we did a portion of this YouTube video that you are listening to right now. It's called Creative Visualization for Sport Performance Anxiety Meditation. I just found this YouTube video when searching for guided imagery videos. There's no script to this, so I also found a script online for athletes in particular and collegiate athletes in particular. So I thought it was sort of perfect to do the combination of the two. So I'm going to read you a bit of the script that the athlete and I would do when we did our data collection sessions. So we would come in and she would listen to this video, and I would read the script as the following. Focus your attention now on your shoulder. Notice how it feels when you continue to breathe slowly, repeating the words healing on the inhale and relax on the exhale. Imagine the neuritis that compromises your shoulder. Focus on this area in particular and become aware of how it feels right now. You may or may not experience tingling around the area or some discomfort, and that is okay. It is natural to feel sensations while doing imagery. Imagine oxygen and blood flowing to the injured area, taking away any damaged cells or tissues. Take this image and refocus on your breathing. As you inhale deeply, oxygen and blood are surrounding your shoulder. And as you exhale, any damaged cells or tissues are being removed. Continue this process on your own for the next couple of minutes, enabling your body's ability to heal itself. So that's the portion of the script we really focused on for this particular patient. Just a little background on guided imagery in general. Much of the research that I found was on cancer patients actually, and how they responded to chemotherapy and guided imagery. So one of the cancer patients said, they felt more relaxed and easygoing, had fewer psychological symptoms, and had a higher self-rated quality of life during chemotherapy. The next quote is from an ACL tear, a patient with an ACL tear, who said there's significantly more improvement in motor recovery than those who did not use imagery. Particular for athletes in the sport atmosphere, there was an enhanced competitive performance, increased motivation, and contributed to athletes' management of pain. And the last one I really wanted to focus on for this athlete, and when I read it, it kind of sparked my interest even a little bit more. There were significantly lower levels of re-injury anxiety and pain, and that's really what my patient was concerned with. Not only was she in a significant amount of pain, she really thought that once she went back into the match, even after return to play, she would get hurt again. So what measures did I use? For the patient-rated outcome measure, I used a Sport Anxiety Scale 2, which was an adaptation of the Sport Anxiety Scale 1. For the clinician-rated outcome measure, I measured the number of volleyball kills. Why I chose to do the number of volleyball kills? That's really the statistic that the athlete is concerned with the most. That's her job on the volleyball court, is to produce the highest number of kills that she can. As an outside hitter, it's really up to her in terms of kills on the court. So that's what meant the most to her. So when we're talking about patient values, really I thought that that's what the patient would value the most. This is a picture of the Sport Anxiety Scale 2. Just the instructions. Many athletes get nervous or tense before, during meets or matches. This happens even to pro athletes. And the scale then asks you to rate each sentence or phrase from not at all, which is a 1, to very much, which is a 4. Some examples of the questions: it's hard to concentrate on the game. I worry that I will let others down. I feel tense in my stomach. I worry that I will mess up during the game. So these are things that I heard the athletes saying to me, which is why I thought this tool was really applicable to this patient. So a bit of background on the Sport Anxiety Scale 2. It's a multi-dimensional measure of cognitive and somatic anxiety in sport settings. It was adapted from just including youth athletes to include college-aged athletes as well, which I thought was obviously applicable because my athlete was a collegiate volleyball player and 20 years old. Some clinometric properties. The internal consistency has been demonstrated at 0.91, reliability at 0.84, and test-retest reliability at 0.87. So not only did I think this really was clinically applicable for my patient, but it's also valid and reliable. So how did we collect the data? After the first initial injury, that several days later when we decided to use this tool, we would collect data every Friday. So why I picked Friday? For one, it's match day. So the athlete, really, that's where most of her anxiety stemmed from, was Friday and Saturday. Because, she was out for such a long time that she got anxious on Fridays because she knew that she couldn't produce for her team. And she cares about the team, and she cares about, winning. She's a competitive Division I athlete, so having to sit on the sidelines was something that was really hard for her to do. I also picked Friday because it gave us a week to work on rehabilitation in the clinic as well. So not only could she see her scores increase with things like range of motion, strength. She could see her scores increase on the scale. So what we did was we went into the office after treatments. We turned the lights down and tried to, sit down, lay down, whatever was comfortable. And we dimmed the lights and we listened to the video that you're listening to right now. The patient would put it on her phone, put it on her laptop, and she would just relax. And then I would read the part of the script that I read to you prior in the presentation. She would then, after we were finished, just take her time, kind of relaxing, and then came out and went to the match whenever she was ready. The patient completed the SAS2, and both of those scores were recorded in Sportswear and extracted for the purpose of this presentation. So this is the data collected throughout the entire process with my patient. Obviously, a couple days after the injury happened was the first time we implemented the data. The data wasn't implemented the day of the injury because we didn't know the athlete would have anxiety or she would be apprehensive. So the first time she took the SAS2, she got a 48 on a 60, which is substantially high. Obviously, 60 is the highest score, saying, yes, I have all of this to the maximum. So she was pretty close to that. She not only was in pain, but she was very, very anxious. And the number of kills, 11, is reflective of the night that she got hurt. She had 11 kills. That's pretty typical for this athlete. She averages anywhere from 11, 12, 13 kills a game. You can see from 10:9 to 10:23, the athlete didn't have any kills because she was completely out. She was not cleared to play for about a little under a month, so she didn't have any kills. But as we progressed rehab and as she could see that she was getting a little bit more functional and she was feeling a little bit better, her score on the SAS2 improved. So the closest to 0 you can get is a perfect score. So really, 46 to a 22 is pretty substantial. And then she was returned to play 10:30. I believe her first game was 10:31 on Halloween, and she did okay. She did about 50% in terms of kills of her average, which was okay for being out an entire month. As you can see, she still had a bit of anxiety in 18 out of 60. She was still telling me, she felt like she was still letting her teams down. She was out of shape. She didn't feel like, she could relax. Her muscles were tense, so she did still have a bit of injury and anxiety. And then by 11:13, she was doing well. She was back to her average kills, but as you can see, she still had a bit of a score on a 4 on a 60, but nowhere near where she started. So I just asked for verbal feedback from my patient, and these are a couple quotes that I extracted when we were speaking after the season. She said that she was able to actually relax her shoulder, and it was cool to see her scores go up. She would see the score and I would record it, and she would get excited when her scores improved. She also said it would make her focus before the match. We would do this right before she went out after treatments were done, and she was less nervous and her body was less tense. So in terms of reflection on my part using this tool, it was really easy to do. The tool is short, it's clinically applicable. There was high patient satisfaction. As you can see, the feedback was all positive. She said even she recommended that I use this tool on a couple of the other girls on the volleyball team. So it did go well, and she said that it was relaxing. But not only was it relaxing for her, it was relaxing for me because, we just got rid. We did probably 2 hours of treatments, and then this participant and I would come in and do the relaxation and guided imagery. So it was relaxing for me as well. The patient improved, so it's cool to see the correlation between the decreased anxiety scores and the increased kills. And then for me, it was cool to explore a new tool. I had never heard of this tool, so it was interesting to see the research behind it as well. In both the script and